planning your dental trip to Malaysia? With over 30 years of experience and a 99% success rate, Kheng Dental is MTC's choice for quality care.
My name is Dr. Lee Ming. I'm actually a permanent resident specialist currently working in Kheng Dental. So Kheng Dental is actually one of the all things in Malaysia, which is also associated with Malaysia Healthcare Tourism Center. So regarding myself, I'm actually a restorative specialist. So what does the restorative specialist do? So restorative specialists, they have two main different branches. So one would be major in endodontics, so which is the one dealing with canal treatments. The other branch would be dealing with prosthetic. So I'm involved in the prosthetic part. Nowadays, usually when we design the crowns and bridges, we can do it via the digital method, as in like we can visualize how it's going to look like, we can design how it's going to look like. So once we have done all the necessary treatment options, then we will send to the machine, we call it a milling process. So imagine a block of stone with the information being input into the system itself. It will start to shave the block of material. Sometimes it could be zirconia, it could be lithium disilicate. It will just trim the block into the design that we wanted for the tooth itself. Intra-oral scanner, I would say that's the future of taking an impression. So during the olden days, usually whenever we want to create a more of the standing model of the teeth, we need to go down to like a very mouth-filling kind of impression. Yeah, how the intraoral scanner comes into play is that first of all, it's less hassle. So actually it's much simpler. We don't need to mix everything. So everything is more cleaner and less messy as well. So, and then patient would not have to experience the gagging effect because the scanner is much smaller compared to the impression tray filled with material. And then last but not least, the best one is the digital data that we obtain. So meaning after every time we scan the patient, the data is stored in the digital file. Whereas if we are comparing to study models, let's say one patient has two models. If we see 100 patients, by the end of the day, we are having 200 models in the clinic stacking up everywhere. Whereas everything comes with the digital data, which can be stored, which can be used as a backup. Kheng Dental itself, we provide a variety of treatment. So one of them would be that we call it the EMS scaling. So technically, the traditional method of doing a scaling is like using high vibratory motion to clean all the surface of the teeth. So what EMS does is that it uses a finer tip, and then it uses air abrasion to clean the surface of the teeth, so which is less painful at all. And then we provide you a more suitable, comfortable experience as well. So we have an array of doctors available, the nurses available. So usually I would say the waiting time would not be as long because due to the availability of the dentist as well. And then variety of treatment option is being provided. So let's say if your treatment is slightly complicated, it requires some specialization. So we have a few visiting specialists as well, like Dr. Alif, that we can consult. So we are going to deal with the patient. We call it a multidisciplinary approach, meaning various specialists will maybe have a look and study about the case itself. Then we can see which treatment option is the best one that can the patient suitable with.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.